Good afternoon, everybody. This is Brian Blacker from PolicyMap. I'm the Senior Director of our Product and Client Solutions team. Welcome to this office hours session. We're excited today to show you the new and substantially improved Community Health Report in PolicyMap. So just a couple of quick housekeeping items too, as we are getting started here. So it is a webinar, it's being recorded, that will be shared after the fact. There'll also be a follow-up email sent with that recording, the video, any additional information from the webinar. It's a GoToWebinar format, so everyone is going to be muted. If you have any questions or issues kind of joining the webinar or kind of interacting with the webinar today, you can use the chat feature in the GoTo tool. And we'll go through a Q&A session at the end, so feel free to add questions into the GoTo tool chat as we're going through, and then yeah, we'll save some time at the end to go through some of those questions. So the goals for this session are, we're going to walk through how to create a community health report for a custom defined service area. So worth noting that this is by far the biggest enhancement with the new community health report in PolicyMap. For any folks who are sort of regular PolicyMap users and who may have used the community, kind of the legacy version of the community health report, you'll know that that version of the report was only available for individual counties or census tracts. You could generate one for Maricopa County, but if you wanted to kind of generate one of those reports for somewhat like non-standard geographies or your own sort of custom defined region, that was a pretty hard limitation. So yeah, so for this session, we're going to go through generating a community health report for the custom region. So we'll start with using the custom region feature to define our service area. That'll be kind of step one. And then we'll actually generate the community health report and spend some time talking about the content and functionality of the health report itself. So let's get started with using the custom region tool to define our service area. So you can create these community health reports for standard geographies like an individual county, a city, a congressional district. So for example, if I search for Columbus, Ohio, and navigate to the city of Columbus, from this little reports button, you'll see there's the community health report. It would be as simple as that if I wanted to generate one of these reports for the city of Columbus or other predefined locations like counties or zip codes or congressional districts. But you can also, as I mentioned, generate the reports for your own custom defined area of interest. So for this particular demo, we're going to define our service area as a collection of zip codes around a hospital location in Milwaukee, Wisconsin. So let's first go over to Milwaukee. So I will search for Milwaukee, Wisconsin. See here the city of Milwaukee, and I'm going to add on hospital locations as a point data set using the data set search, put on hospital locations. You'll now see these here with the little pin icons for the different hospitals in and around Milwaukee. And I am going to be using this Ascension St. Mary's Hospital as kind of my hospital location around which I will build the assembled custom region. So to actually create that custom region or use the custom region to define that service area, I'd use this custom region button just to the right of the location search. And I'll see any previously saved custom regions here. I'm going to use this second tab to create a new one. So custom regions in PolicyMap, you can use, you can draw on the map, using like the street network. You can use a radius as just like a circular radius around a point or an address. I'm going to use this option to use the assembled regions. And this allows me to, assemble underlying geographies. I am going, since I'm going to be really defining this based on zip code areas around my St. Mary's Hospital location, I'm going to change the assembled boundary from block groups to zip code areas. And I'm going to use the zip code tabulation areas for this. And so now I can start clicking on zip codes. They'll fill in that orange color to show that they've been added to my custom region. Over here on the create assembled region little box, you'll see those that have been added. I can click on the X to remove one if I wanted to. So let's say I'm using these 7 zip code areas, and I'm going to use that to define my service area around this Ascension St. Mary's Hospital. So I'll click on continue. So now this is going to show me my custom region boundary. I can give this a name. You can also change like the outline color, transparency too, if you'd like. I can save this custom region. I'm just going to remove that Milwaukee boundary so it's not in our way. And you can always come into back into your custom region and make edits, to the display, the name, the title, or the shape itself as well. So now I've created and defined the service area. And so now from my service area custom region, if I click on the reports button, I can just select one of the report options. So we do have a community profile, which is going to be kind of more kind of core demographic information and population information. The community health report is kind of the newest report or kind of revamped report in PolicyMap. And so I'll select the community health report. And we'll just give it a second to kind of navigate to my service area, which will show up here in the map. And it's going to start populating the data into the community health report based on that service area that I defined. So as I start to scroll down, you'll see some of the data and metrics, some of them still filling in a little bit. But there's lots of content within the community health report. So one thing that's really helpful is using kind of this table of contents navigation over here on the left-hand side, which allows you to, jump to different sections. So if you're interested in healthcare access indicators, I can select that from the left-hand navigation, see the different sort of modules that are in here for healthcare access. So you have like some trend charts related to primary care physicians and nurse practitioners and dentists, accounts of health facilities within my service area, a couple of maps showing things like medical, whether there's medically underserved areas within my service area or health professional shortage areas. There's also like a rural status indicator, which has become kind of emerged as a pretty important indicator related to rural health and some of the federal programs around that, some health insurance coverage. So this left-hand navigation can be used for kind of moving to different sections of the report. You can also toggle or kind of temporarily hide sections from the table of contents to kind of just focus on specific sections of the report that are most relevant to the service area that you're looking at or the particular analysis that you're doing. So, maybe you're an organization that's really only interested in some of the health risk factors and some of the more like social drivers of health. And so maybe, population demographics is important, but maybe you're not as interested in the, healthcare access. Sorry about that. My internet froze up for a second. So yeah, maybe you're not as interested in healthcare access. You want to keep health risk factors in, um, but mortality and the health conditions data can be hidden. So as you scroll through the report, you'll see that it's temporarily hiding those things and kind of just focusing on those sections that are most relevant, and that you've selected using the navigation over there. And you can also reorder these too. So if you wanted to have some of these other social drivers of health above food and nutrition, you can also move things around as well and really kind of make the report your own, and kind of organize the content as it best suits the particular analysis that you're doing or the particular report that you're trying to assemble. So let me go to the health conditions section and just kind of go through, kind of show a little bit more about the the type of data that's in here, as well as some of the other functionality of interacting with the report itself. So within this health conditions section, we have some modules related to self-assessed health coming from CDC Places. There's actually several kind of modules in here that are using indicators from the CDC Places data. So there's chronic conditions on, so that you can really quickly see within your service area, the prevalence of high blood pressure, diabetes, arthritis, relative to the national averages. There's some trend charts related to depression and cancer incidence. There's a module for cancer incidence by type and by race, ethnicity, as well as some sexually transmitted infection conditions in here too. So with the actual modules themselves, you can explore different views. So, you can, there's going to be things like a table view if you're kind of wanting to see it kind of more in table format using column charts or bar charts. You can change the visualization, and those views will be set, really based on, the content of the particular module that's being displayed. And so it's just another way in which you can, again, customize the look and the display of the different data that's in the report. So a couple of different view options there. Worth noting that things like cancer incidence by type, these are going to be data from CDC that's only available at the county level. And so in cases like that, what you'll actually see data for will be for the county in which the in this case in which the service area sits. And then you also see benchmark information like for the state, so that you can at least be able to see for Milwaukee County, the county in which our service area sits, cancer incidence for the county of Milwaukee and the state of Wisconsin. Similar for the cancer incidence by type and by race, ethnicity. You'll see those county values and the state benchmark too. Within the module, so in addition to being able to change the display view of the data, there's also this little button for each module where you can generate quick AI insight summaries. And so if I click on that button, usually just takes a second, it should start to populate a little bit of a summary of the data that's shown in that visualization. In terms of how those summaries are populated, we have like an endnote that goes into some detail on it, but it basically, just sort of extracts the data directly from that data module, and that's what's actually being sent to the model, the LLM, to be able to return just kind of a quick textual summary of it. So it's really not kind of going outside of the data from the report itself. And it's really just kind of returning like a text summary and some basic insights. You can make edits to these summaries too. So if you click on that edit button, you can add additional information in here. You can try and just regenerate the summary again. And then once you click on done, it'll save those changes in there. And for, across all the different, modules and sections here, you're able to also download and export just certain pieces from the community health report. So if you click on the little download button next to a particular module, you can download the underlying data as a CSV file. You can also download the, the visualization, the data visualization, and the AI summary as a PDF or as a PNG image file too. And so that's, those just generate directly through your browser. And, again, if you want the underlying data, you can access it that way, but you can also just get those quick images and data visualizations to be able to use, outside of, this particular report in PolicyMap. So, as you're going through and making any changes, turning off certain sections of the report, changing some of the visualization views, adding some of the AI summaries and stuff like that, you can save save those changes and save this report using the save icon. So up at the top of the report, there's a little save icon. You can save this into your workspace, come back to it, and it should, it will save kind of all of the customizations that you made to that report, and something you can come back to in the future, as the underlying data from the PolicyMap data library gets updated. Those, will flow through to the community health reports as well. You can also print or export using the little printer icon, like a full PDF of the entire report as you kind of have it currently configured. And additionally, there's this at the very bottom of the table of contents, you'll see this link to restore the default report. And so if you use that option, then it just kind of restores all sections, kind of restores the default order of all sections, as well as the kind of the default views for each of the modules. So couple of other just content highlights. I think I've kind of shown these quickly, but yeah, I think maybe just to highlight a couple of other new additions under the health risk factors section. We've added the CDC Social Vulnerability Index, Maternal Vulnerability Index from Sergo Ventures as these kind of snapshot maps to show that within those service areas. And there's been a lot of other data additions as well, from the kind of legacy version of the report that were incorporated as this update was done. So the other thing just that I'll mention is that obviously, since in this, demo, we're showing how to generate one of these community health reports for a kind of custom defined service area. And so when you are scrolling through the report, you'll see kind of underneath different sections the data aggregation notes, which will show, that in this case, it's showing the prevalence of these chronic conditions, and it's aggregating the underlying data from those 7 zip code areas that were selected for the defined service area. In some cases, it may use like a different boundary type for aggregation if data wasn't available for like those 7 zip code areas for a particular time frame or something along those lines, and you may see that. So, but there, each module will show the how the data was aggregated to populate within the data visualization. And then at the very bottom, if you kind of jump down to the endnotes section, which is kind of the last one in the table of contents, this is where it will actually kind of list out the boundary aggregations so that it's captured, that detail is captured in case anybody kind of wants that granular detail. And then in here there's some other just kind of explanatory notes about some of the data in the report as well. So I know we didn't go through kind of all of the content of the report. There's lots of sections. I think we've tried to keep the sections themselves pretty consistent in some ways with sort of the legacy version of the community health report, but then also kind of chunked out certain things like some of the social determinant, social driver of health sections have kind of now been broken out into sort of their own subsections with different modules to them, like financial stability, covering income and poverty indicators, and the infrastructure and built environment, kind of talking about housing and transportation, and some of those other sort of more social driver of health type of indicators. So so that's at least kind of a good, provide some primer here of, the community health report, running it for a service area or a custom region. You can kind of explore this with all kinds of different, as I mentioned, predefined geographies, or running it for select cities or congressional districts, or creating your own custom regions and generating the reports for those custom regions. When you're actually in the report, if you click on that little show options at the very top, from here you can switch to a different location, select a different custom region if you're kind of going between a few different service areas or custom regions that you may have created under your account. You can also just kind of select different ones and generate the same report for another custom region by selecting it from that list, or using another predefined kind of standard geography like a city or a county. So happy to answer any questions. Phil, if any questions have come in through the GoTo meeting.
Yeah. I absolutely love the updates to the health report. I think the biggest update is the ability to do practically any geography now. So some really good questions, some about geographies, and then two that seem to be coinciding with each other, which is about data. So Casper had a question of, is the HIV data retrievable? And then Susan just had a general question, is how do I download data for the charts?
Mm-hmm. Yeah, for downloading the data for the charts, that you can use this little download button just next to any individual chart. So every sort of, we call them, I've been using this term modules, but every kind of metric or kind of data visualization module that is in the report, you will see that little download button in the kind of right corner, and you can download that first option to download this data as a CSV will give you the underlying data for these charts. So if you wanted to like recreate them or kind of just use the data in Excel or something like that, and it's those CSVs can be opened in Excel. The HIV data being retrievable, so we don't have the HIV data currently in here as a one of the modules, but it's definitely something that we can consider adding for sure.
Yeah, I think I'm betting that a part of that question is they're probably trying to even download the underlying data to those parts, but uh, I'm it's not a part of the report itself, right?
Yeah, in terms of like downloading the raw data, that's really something that you would do within kind of PolicyMap using the data download. So yeah, it's worth clarifying that like the download that you generate from, I can even just do one like this population by age. The CSV that you're going to be getting, actually, I guess I may not be sharing all of my screen here to be able to see this, but the um, the data that you're getting here is going to be kind of like the summary level data that's populating this chart itself. So it would be like a CSV that shows your you know custom region and the percent population 0 to 4, 5 to 17, 18 to 64, and these values. And then the same thing for the state. So it's kind of more like that summary level data that's being reflected in this chart. But if you're wanting to download kind of like the more like raw data, so for example, you wanted to see, um, you know, what like the population over 65 is, for all the zip codes within that custom defined service area. You can download that data, but it's kind of outside of the report itself. It's really something you can use the data download, which is that button up here in the top right hand corner, and you can download data, use that custom defined service area as like a your region or your area for downloading the data to, and you can download individual indicators that way.
Perfect. Yeah, I definitely. Well, we can definitely follow up with more instructions for you, Casper and Susan. Joy had a really good question, and I think it's a part of the comparative part in the report itself. Just wanted to know if we can define two areas in one report. So, for example, the defined area and maybe a county or state. So right now the default
Mhm.
is the state, right? But I guess you're trying to do a comparative reports.
Yeah, so at the moment, in terms of the benchmarks that are reflected in the report, it is using state for the most part. Um, the one exception is some of the modules that are using CDC places data, because the places data isn't released for individuals, like there aren't state values released in that data set. So the places indicators or modules are going to be using like the national averages. So that's where you'll see like the US here. This is coming from places. Um, but yeah, primarily across the other modules, really like the benchmark is going to be the state. Um, the eventually we are hoping to kind of add some more flexibility to the benchmark definitions so that they could be a bit more user defined. Um, and that would be something that we'd be kind of looking like an enhancement we'd be looking to kind of do in the future. Um, the but at the moment, yeah, like benchmarks are primarily just state, or in the case of some of the places modules, it's using the full United States or the kind of the national averages. Um, but in terms of, I think, one thing I'll say is that you can really, if you've created like a customized kind of version of your um, community health report and you want to generate it for different locations, um, you can kind of just, like if we have this one for this Ascension St. Mary service area, if I wanted to generate one for Cook County, Illinois as well, right? Like you can kind of, it'll save all of the same sort of customizations that you made in terms of what sections are reflected, um, any kind of changes that you made to sort of the data views within the modules. And it's just switching to like a different location. So it is really pretty dynamic in terms of being able to say, create this report, use this service area. Now I want to sort of see that same report for like another location, like a county or maybe like a service area of another, another custom defined region or service area. You can really kind of toggle pretty quickly and sort of regenerate for other report areas. So to be able to get the same information or kind of get the same sort of charts and stuff like that for other locations too. So just something to keep in mind.
Perfect. There's a similar question, but we'll come back to that in a second. CJ wanted to know what's the preferred way of citing the data in the report. I know we have a citing tool, but I don't think it's in the report itself, right?
We don't have the citing tool within the report itself. Yeah, every module does have like the data source, and this will link to our data sources page. So if I click on like this HRSA source, let me just share, kind of switch my tab here. So it'll show like our data source page for that HRSA, Office of Rural Health Policy. So there's more detail on the source. Um, let me just hop back to the report, but there's not like a particular citing tool within the report per se. We do have kind of in the way that like on the maps page, as you're kind of interacting with data on the maps, we do have like a citing tool. This one, since it's kind of really includes like a pretty wide collection of sources that are represented across all the different data modules, we don't have kind of like one singular kind of like citing tool to it. But each module does carry the source information, and that does carry through to like anything that you would export or download, either the whole report itself or the individual sort of like pieces from the report. So yeah, so hopefully that helps.
Yep. Yeah, that's definitely very helpful. Casper is very interested to see what a congressional district report looks like for the community health report.
Sure. Yeah, we can do it right now. Um, so yeah, so this would be kind of more of a predefined location. Not that necessarily all of this data is released for congressional districts, but in terms of PolicyMap, it's kind of like one of the built-in boundaries. So if we were to use, maybe Arizona's 2nd district, just kind of picking that one randomly. And I can restore the default report. So once everything starts to kind of load, so we can start to see some of the data that it's showing. So yeah, so it will show us the congressional district boundary here. This one is going to be kind of it kind of touches multiple counties and probably includes multiple counties in the state of Arizona. So yeah, so I'll point out, some of the things that are going to be kind of unique when you have like a report area that includes, multiple counties or kind of bridges across multiple county boundaries. But so it'll, a lot of the modules will look similar. Obviously going to represent different data, but will look pretty similar to like the custom region sort of service area example that we've been using. I kind of hop down to like the health conditions. I should see, the health conditions, and it's aggregating, 6 counties for kind of the latest time frames. For some of the older data where probably the county data wasn't available or there was some insufficient data, it's aggregating census tract level. But so yeah, so it's again, it's going to be aggregating. There's some sort, and then you'll want to make sure that you refer to the source details to see that it is aggregating data. Here's where you'll kind of start to see some deviation from the service area example that we used, because that service area was one that just fell within a single county. And so in this case, when it's like a report location that crosses multiple county boundaries, you'll see the data is kind of shown in more of like a table format, rather than kind of all the different sort of data visualization views. So it's kind of worth noting that, like, as your report area gets more complicated in terms of crossing multiple county or state boundaries, the the report is still functional, it still works, but there are going to be kind of more limitations in terms of the data visual, kind of like the data views or the data visualizations that are shown, and it'll kind of fall back to kind of using more tabular data like tables to show here's the 6 counties that are encapsulated or kind of touched by the congressional district, and here's like the cancer incidence rates for each of those counties, similar kind of layout of the cancer incidence by type. And so this is really kind of the way that the report handles those more complicated report areas that cross county and state boundaries, but where there and where the underlying data is kind of like only available at the county level or something like that. So where there's data that's available at smaller geographies like census tracts and that kind of thing, like some of the census data and the places data, it is going to be able to aggregate more, because it has those smaller kind of pieces to be able to aggregate.
Yeah, I think the incredible benefit of the report now is that it can do um, these more complex geographies. So I think a very similar question that might be related to the aggregation of this is from David, which is about the difference between the health report here and the a community needs assessment.
Hmm. Yeah, I think the like a sorry, something just popped up for me. So I think the differences. So yeah, so I think a lot of the data, and this has kind of been the case even going back to sort of like the legacy version of the community health report, a lot of the data and like content that's in there is aligned with the type of quantitative data that's typically gathered as part of like a community health needs assessment. So it has demographic information, population by age, by race, ethnicity, um, data on health conditions within the community, access to healthcare, certain social drivers of health like educational attainment and housing, and access to transportation. So a lot of that, was kind of modeled around, being able to kind of provide some of the kind of core quantitative data needed for a community health needs assessment. Um, I think, we've said it a couple of times, but yeah, for sure, being able to get that, community health needs assessment kind of baseline quantitative data for, kind of aggregated on the fly for these custom defined areas, is probably one of the biggest kind of advantages of this report tool specifically within PolicyMap. Um, I would say that there are things like the community health needs assessments typically complement the quantitative data with more qualitative information that's gathered through like surveys and kind of more like primary data collection, and that's not something that this report offers, but it's a really good starting point in terms of pulling together kind of those core quantitative data elements, for a community health needs assessment for sure.
Yeah, yeah, I think the amount of data that's being offered is very similar and super helpful for a start. So any other questions, just please add them into the chat window. Some great ones. I think we handle a couple of leftover ones. Lisa had a question about, can the reports be shared via web link? or do they need to download and share the reports
Hmm.
as a PDF? And then, is the reports themselves, are they meant for internal data or internal use? But it's one of these tools where we let users really use our data anywhere, right?
Yeah, I think it's kind of the same sort of typical terms of use that apply to kind of like regular use of PolicyMap and the maps and stuff like that. Carry through to these reports too. So I think it's like keep which the terms I know are like keep the no keeping like logos there and all that kind of stuff. But like it can be used in you know with internal and external uses. The sharing of the reports itself, kind of that functionality question. So you'll see if I kind of scroll all the way back up to the top, um, there's really just this save and print option. Um, there is some limited sharing available, particularly kind of specifically within site licenses of PolicyMap. So like if you have a university or academic license, or you have kind of your own um, site license to PolicyMap for your enterprise, you can share, like generate links to a community health report that you've created with other users of that same site license. Um, but outside of site licenses, there's not really the sharing capability, because there's just um, too much. There's kind of some underlying data restrictions and those kinds of things too, functionality wise. Restrictions in terms of kind of like the report, being able to generate reports being something that's just available for subscribers to PolicyMap anyways, as opposed to kind of the more kind of public version of the tool. So yeah, it's the sharing is a bit limited to just within site licenses, but that may be helpful for some of the folks on the webinar.
Yeah, and the PDF is completely shareable, so users can
Hmm.
share that among anyone else. All right, so I think we'll take one last question. It's a pretty cool one, just because even though we created a very complex report, um, Marvin wanted to know, can we customize the report further, or are there costs for doing something much more custom?
Um, so there's not, I would say, so the customizations within sort of the this readily available community health report are mainly kind of some of the things we've talked about, like turning on and off different sections, changing the display views of different data modules, those kinds of things. Um, so there's not kind of other customizations that are available in terms of like adding other data modules, or I think we have gotten some questions about kind of like color options and color ramps and that kind of thing. Um, so so those aren't available from kind of this you know this out of the box, I guess, sort of community health report. We do have the ability to create sort of custom reports, so kind of like custom versions of these types of report tools. But yeah, that's typically something that's like an add-on to a subscription, and there is some cost associated with it depending on like the scope of work involved. But it is a possibility. Um, and in those custom reports, it can kind of include like a combination of some of the modules from this report and the community profile report, as well as sort of like custom built data modules. And so that's something that is doable, but yeah, it's typically kind of handled as more of like a custom project.
Awesome. Some really good questions. Seems like everyone's very excited for it. And I think that's it. Any other questions that didn't get answered in the chat, we'll follow up directly. Otherwise, I'll leave it to you to close. Thanks, Brian.
Cool. Thanks, Phil. Yeah, I just wanted to thank everybody for taking the time to join this office hours webinar, and I hope it's been a helpful kind of introduction to the new community health report. Definitely please provide us with feedback as you start using it in your work, and we're always happy to hear other suggestions and feedback. Up in the top right hand corner is a little feedback button. So please send us feedback as you're working through starting to implement this and use this in your work. And yeah, thanks again, everyone, for taking the time, and enjoy the rest of your afternoon.